Good afternoon, good morning, good evening, everyone, and welcome to the session called Africa Rising, Shaping Global Health and Innovation. This is a short session, but we would like to handle here or present here a very big issue, innovations in digital health coming from Africa. So this session will explore how Africa is accelerating digital health transformation and shaping global innovation agendas through collaboration, local leadership, and ecosystems thinking. I have a little bit personal story here. Last month in October, I had the pleasure to attend Africa Health Tech Summit in Kigali, and this was truly eye-opening experience where me and my colleagues from Global Health Connector could see how many fantastic innovations are being now developed in Africa. And we are committed as Global Health Connector to connect the dots across continents and also bring those, to promote this work done in Africa to our global community. This is a short session, and I'm joined here with 4 fantastic speakers. I have Francie Sadeski from Technopolis Group, working on the project Africa-Europe Innovation Platform, who will give us a short introduction to the session and tell us what is happening in this cross-continental collaboration on innovations. We have Dr. Francis Ohanyido from West African Institute of Public Health, Ota Akhigbe from eHealth Africa, and Vivian from Africa Digital Health Network. This was the short introduction, and without taking too much time, I will pass to Francie Sadeski to set a little bit frame for the session. And Francie, the Africa-Europe Innovation Platform is not only about digital health, it's about the collaboration on innovation. So this is the broad introduction, and then we will go directly to the speaking about digital health with the intervention from Dr. Francis, Ota, and Vivian. Francie, the microphone is yours.
Thank you very much. Thank you very much, Karolina. So welcome again, everyone. It's really truly an honor to set the context of this Global Health Connector Summit and this session. My name is Francie Sadeski. I'm the leader of the Africa-Europe Innovation Platform. This platform is part of the joint Africa-Europe Innovation Agenda that is co-created by the African Union and the European Union to strengthen our cooperation in research and innovation. It's funded under Horizon Europe, and it's an EU flagship research and innovation program. It's been designed to deliver on the agenda priorities and to connect the innovation ecosystems of our 2 continents, to build bridges where there are gaps, to accelerate collaboration where potential already exists. This platform is a natural continuation of a journey, one that started with earlier successes. You may have been informed about the Africa-Europe Innovation Partnership with like 5 years ago, and we learned that ecosystems needed visibility, shared tools, and continuous dialogue. And there was also another initiative under Horizon Europe support, and it's the Enrich in Africa and the Enrich in Africa Center. So really, the Africa-Europe Innovation Platform is a continuity, and with a critical timing now that both continents, Europe and Africa, face profound transformation from climate change to digitalization, to new challenges also to global health, with democratic shifts and the sustainable growth needs. It's more critical than ever that there's collaboration across continents and collaborations across the whole innovation chains, tackling like the needs of the innovators, the civil society, and bridging the gaps and connecting the dots also with, I would say, the academic communities with the private researchers. So Africa and Europe, they have complementary strengths for sure. And until now, our cooperation in innovation has been sometimes fragmented, short-term, project-based. And we know that ecosystems, even within Europe or within Africa, are sometimes also very disconnected, like groups. Again, researchers might not be talking to the private sectors. So the IEP emerges as a mechanism to connect the dots, and it combines technology and human connection. So there's a digital space, a sort of one-stop shop for research and innovation, with news, events, funding calls, training, matchmaking, investment opportunities, and more that are just brought to support any type of needs that you would have as innovators, you would have as academics, you would have as researchers. And there's also a human space with real-world activities such as twinning programs, thematic challenges, training sessions. I don't know whether the slides are just going correctly because oh, it's coming here. Sorry if it's been late. I'm showing the slides just right now. And so again, there's this digital space that is creating knowledge and connecting communities, fostering partnerships. And there's the real-world activities that are really, with the training program, thematic challenges, training sessions, intending to bring in the communities innovative approaches to funding research, with making sure that the silos are just broken, and that, there's good collaboration. So we are the network of networks, and we aim at really sort of like putting into music all that already exists and do more. We had absolutely thrilling opportunity in the 22nd of last month to meet in Brussels for launching the platform. It was a full day of sessions presenting the platform. We had panelists, including from the EDCTP, that is a super important initiative that's from a long time, that was speaking at our panels. We facilitated matchmaking by on Conversation Starter. We had 150 in-person attendees with also almost 200 online unique viewers. And we had already 50 people onboarding on the platform, and we can say that it was about 300 connections being made this very day with people who had not spoken with each other before, and we hope to follow up on that and to see how many like new initiatives or products will come out of it. And as introduced by Karolina, the platform is not specified just for health or for green or for digital. It's for all type of sectors, I would say, but we aim at bridging like the gaps also between the sectors, so that cross-sectoral research could be happening, because like we aim at facilitating you meeting with any other, again, research teams or innovation teams. And the next day was the innovation fair on the 23rd. Absolutely brilliant day also. So you can see some of the pictures of the event that went on the 22nd. And we had also a speaker from the EDCTP that is just rounded here. And the innovation fair was absolutely amazing day also, with it was about almost 900 attendees being present or remote. And one of the important things I can also mention here is that we had pitches. 18 pitches were selected to present their, I would say, startups and their plans, and all of them will be onboarding on the Africa European Innovation Platform for being accelerated for de-risking. So they will be accompanied to really work well their I would say business plan, and being matched also with investors. So this is also what the IEP is doing, is making sure that when there are incredible innovations that are out there, we can be accelerating them. On the 18th, there was, I believe, like 5 that were belonging to the cluster that we call global health. So it was about maternity, health, it was about access to medicine remotely through digital medicine. It was about also using, well, that's to quote some of them. So in a nutshell, this is setting the scene. So the Europe and the European Commission and the African Union are engaged into making sure that, again, more innovations for tackling the very important challenges that our communities are facing, and making sure that there's the best connections happening, the best minds, and that these projects do find, I would say, funding so that they will be scaled. Thank you very much.
Brilliant. Thank you so much, Francie, for letting us know about this initiative. And I think that a lot of participants from our community can follow up and engage. And as you said, this is, of course, for the framework for working on all the teams under the African Union, European Union Innovation Agenda, but health is one of those themes. It's one of those priority priority topics in the agenda. So with this, and also like our mission as Global Health Connector is to create those connectors, build those platforms, and build those bridges. We invited three colleagues from Africa, Dr. Francis, Ota, and Vivian, to let us know a little bit, to share their perspective from African innovators about the topic of the session. So shaping global health and innovation in Africa. I invite you now for short presentation, short intervention to bring this perspective to our global audience. And I will start from Dr. Francis. I will pass this digital microphone to you and for your intervention, for your presentation. It's some 4 minutes, I believe.
All right, thank you very much, Karolina, and thank you, Francie, my namesake, for setting the tone of the conversation here. I think it's very helpful because I think, let me first say that when you talk about Africa Rise, it's about global health gain, because a large chunk of the problems, 24% of all the disease burden globally are resident in Africa. So it's significant that Africa should rise, and Africa should be rising in one form or the other. But the conversation about Africa rising over the years have been more economic, but recently it has become honed down to global health. And of course, global health includes digital technology, and it's very critical that we look at the landscape and see why this is very, very, very important for all of us. Let me say first that the youngest population in the world resides in Africa. In fact, most of the Sahel belt is home for the youngest population on the continent, and the average population of that population is somewhere around 25 years. And Nigeria, for example, I think our average population is somewhere around 20. And if you look at the whole ecosystem of digital technology itself, there are 9 unicorns on the continent currently, especially in the fintech industry. 5 of them are in Nigeria. And this is significant in terms of what this says about the potential of young people to adopt and also innovate to drive technology. But most of the founders of these companies are very young people. So empowering Africa's health future and our drive towards what we call the health sovereignty is resident in how we are able to marshal our ecosystem of young technology developers and all that within the continent. And it's a big opportunity, it's massive. And I can put that in terms of projections and numbers. If you look at the issue of, there have been projections that if you look at the global economy, that is estimated to by 2024, it will be around 288.55 billion in terms of estimate. I'm sure it's gone beyond that, and then projected to almost 1 trillion by 2030. And this is very significant. And if you look at this relatively, it said that Africa's economy is projected to be 180 billion by this year, in terms of what comes from what is called the internet economy. And this significantly includes things like digital tech, especially health tech and the rest of them. That is significant. And if you look at all that's been going on recently, we now talk about the M-Pesa moment globally. The M-Pesa moment reflects on what we've done with fintech bringing it to health tech. And this is an African term because M-Pesa have done very well on the continent, especially in Kenya and some countries in the eastern part of Africa in terms of mobile money and all that. So it's an opportunity for evolution for Africa. And we are rising to that fact. And one of the things that's happened recently is in the area of policy and using policy to shape the landscape. With the coming of Africa CDC, for example, there have been flagship programs like including the Africa Digital Network. For some of you who were in Kigali, you now know there's an ADHN that tries to bring together and create a platform for that evolution to take place. And another thing that's become very critical too in terms of how we do these things is how, in terms of how we look at the reflective side of research. Research is key. For a long time, Africa has not been part of the research around the things that have driven these innovations globally. But now we're becoming part and parcel of those things. Universities are being set up labs and all sorts of incubators and hubs for digital development. Those are big opportunities. And I think it's something that we really need to reflect in terms of how we as a world looks at these things. And I want to make a 6 notable calls for action around this in terms of the fact that borrowing the word from a good friend, Brian O'Connor of GHC, who said that collabo action. Let's collabo act, and that is very, very critical because we already have the gems of what can evolve for that Africa Rising to really accelerate. And this includes sharing expertise, looking at resources that strengthen health systems and promote innovation. We need to innovate more, by developing and scaling up innovative solutions. I help with this agenda towards Africa Rising. And partnership across the board is very, very key. How we partner is very, very key in terms of fostering respectful partnership, as the Africa CDC will say as one of its new public health orders. The idea that partnership is not a one-side thing. It's actually something that involves some respect alongside it. And how we invest, we need to make stakeholders understand that there's an investment destination for digital health. Health tech is a very good play and it's booming. And we need to see how we can marshal that to be able to drive that Africa Rising for global health gain. And then, of course, we need to leverage, like I said, our continent is bursting at the seams with young people. We need to leverage on that to be able to drive that agenda. How do we get them to innovate more? How do we get them to see the opportunities in the setting like health beyond just the fintech and other industries? We need to do that. And we need to grow, get them to walk within an Ubuntu mindset that I am because we are. So it's a very critical thing that we need to begin to shape that mindset so that they see the social industry, as I'll put them, as opportunity for them to be able to build their own value stream so that the continent can grow faster and be of benefit to them in the long run. Thank you. I think I'll leave it there for now.
Thank you so much, Dr. Francis, for this introduction. Africa's Rise, Global Health Gain. Thank you for this inspiration. And I will pass directly to Ota. Ota, you work for eHealth Africa, and you work with developing the international collaboration based on principles for the future. This is something that you would like to bring to this discussion today. I think we can get your slide on and yeah, please share your view on this topic of Africa Rising with us.
Thank you, Caroline. Thank you, Dr. Francis and Francie. I think I completely agree with what has been shared so far. So I'll just touch on this slide very briefly because these 3 ideas that I share here really anchor how I see Africa's role in shaping the next wave of global health innovation. So the first is Africa-led, globally partnered. You see, across the continent, we're seeing ministries of health, we're seeing Africa CDC and coalitions like the Coalition for Women's Health in Africa. We're seeing them set clearer priorities and standards. And we're also seeing partners increasingly choosing to align to those national and regional blueprints instead of designing around them. And that is exactly how we work at eHealth Africa, co-designing with governments, strengthening surveillance, supply chains, and primary healthcare in ways that are fully owned locally. It's not about pushing away partnerships. It's truly about strengthening the African center of gravity. The second idea there is the shift from pilots to shared systems. Pilots have taught us a lot, but the real opportunity now is can actually run and sustain. In our work, integrated digital supply chain and cold chain systems supported more than 174,000 children to be immunized through PATs this year. And our commitment with UNICEF to solarize 238 primary healthcare facilities is about making sure those digital systems sit on reliable, climate resilient infrastructure. So when you look at communities, for communities, the innovation is not the technology. The innovation is the reliability, the care, the data, and the vaccines being there every single time, not only when a project is active. And the third idea I have there is backing local conveners for long-term impact. So we see sustained progress happens when African convening organizations, such as the West African International Organization, which Dr. Francis leads. We see the Africa Digital Health Networks. We see the COA, which I mentioned earlier, and many others. They are resourced to keep government, community, and private sector aligned. They keep the architecture of that coherent. So I believe that multi-year flexible support is what allows those organizations, including ours, to hold the data, coordinate stakeholders, and run systems at scale. So the key message from me is simple. Africa already has the leadership and the demand to shape models the rest of the world can learn from. So what will determine the trajectory is how well we align to Africa-defined priorities, how boldly we invest in scalable systems, and how intentionally we resource the conveners who keep these systems working. So very quickly before I cede the floor, I think I want to speak specifically, when we talk about Africa Rising in digital health, I think less about individual apps and more about who is shaping the architecture. For me, the real shift is that African institutions, like some of the ones I mentioned earlier, are increasingly setting the priorities and standards and inviting global partners to plug into that frame rather than parachuting in fragmented systems. That's what I mean, and that's what I meant when I say Africa-led, globally partnered, not just Africa-located. So I would pause now. Hopefully we can take on a lot more when the conversation progresses. Thank you.
It's perfect. Thank you. Thank you so much, Ota, for this presentation and also this beautiful visual slides that I think explains a lot. And I think today and also yesterday we've heard a lot, of course, about in the context of Africa and collaboration, action, and that it should be, of course, based on genuine partnerships but what I also like, and this is not Africa specific, what you said, that innovation for the communities is not the technology, it's the better delivery of the services and the accessibility. So this is, I think, something to take with us from the summit in general. Then I will pass to Vivian. Vivian, you contribute to the development of the Africa Digital Health Network, and you are also a voice of the youth, and of course the strategic frameworks in Africa also recognize youth as a very important actor in this transition, in this transformation. Please share some thoughts with us. And after that, I got the message from my colleague Adriana, who is monitoring chat, that we have some questions. And as we don't have that much time, I will definitely take them immediately after Vivian's intervention. Vivian.
Thank you so much, Karolina. It's genuinely an honor to contribute to today's conversation. My name is Vivian, as introduced, and on behalf of young practitioners and innovators across Africa, I'll be speaking on the perspective around youth, innovation, inclusion, and leadership in Africa's digital health future, and also to talk about Africa Digital Health Network, the work we do around youth engagement in partnership with our Youth in Digital Health Network, one of the Africa CDC youth program, a community I work with every single day. For Africa Digital Health Networks, we're a growing, vibrant network of networks of health professionals, innovators, institutions, and policymakers who are committed to accelerating digital transformations in Africa health system. And across the youth docket, and as well working with YDHN, we engage with emerging leaders from more than 40 Africa countries. And today I would like to speak very intentionally from their perspective as I'm representing their voice, because youth innovation, inclusion, and leadership are not abstract themes. These are forces that are actively shaping our future. And for me, today's theme, which is Africa Rising, is not a motivational phrase, because it's something we witness daily. Africa has risen, all right, and young people are flying the wing. I know are flying Africa across different sectors and areas of digital health. Young people are building innovations, fixing, the community healthcare systems, leading hackathons, where solutions are engineered around even the challenges we have, which is unstable electricity, multilingual communities, and all. So, and this is where Africa transformation is being built. We hold the largest youth population on the planet, right, with 65% of our population aged 18 to 35, and we also show that 25% of the global disease burden and operate at just 3% of global health workforce. So our health system already carries this burden, and I believe this data are not statistics, they are instructions. They are telling us that if Africa is going to strengthen its health systems through digital transformation, young people cannot be an afterthought. We must be at the center, right? And young people are already stepping in, okay? Dr. Francis mentioned that we have the fastest growing digital health markets globally. Between 2019 and 2023, almost 60% of digital health innovations we see are youth-led and youth-driven, okay? And this is a reflection of what young people are already doing. So through our network, the YDHN, ADHN, we have created a continental space where young innovators can collaborate across borders. Our vision is to build a network of young Africans who are equipped to drive and shape digitally enabled resilient health system. And currently, when I did the data yesterday from our membership program, we have over 200 young people, young innovators who are actively working around telemedicine, health informatics, deploying electronic medical records in their community, driving AI, diagnostic support. So it's not theoretical anymore that we are supposed to be leading. We are seeing it in action. And even at continental scale, during COVID-19, the AU Bingo initiative by Africa CDC mobilized thousands of young Africans to drive vaccination across the continent. So this is already demonstrating that youth networks we are not only energetic or making noise, we are strategically effective at scale. And if you look at the Africa CDC youth engagement strategy that was just released recently and launched at CPHI in Durban, South Africa, it's the first continental strategy that explicitly names young people as key stakeholders and not beneficiaries. So this recognition matters, but it's not enough. We still need to, keep building our talents, keep giving young people visibility, access, and trust, right? Because we want to co-create, we don't want to just be consulted, we want to implement, and we want to be trusted. Okay, so when we talk about innovation, inclusion, and leadership in Africa's health future, we must recognize that youths are already driving all of these three. But of course, we need more support and more systems that are worthy of our contributions. Thank you.
And thank you so much, Vivian. I think we can envy your, the way the youth is organized and also represented in Africa. And this can be uploaded. I remember when it was mentioned during the Africa Health Tech Summit when the Rwandan digital health app was presented, and someone said, "Can you guess what is the average age of the developers of this app?" And I think that it was 21, which means that yes, indeed, the young talents have been working on this. But what I understood also with the full understanding how this should work and be functional. I would like now to invite my colleague Adriana Diaz, who is working at Global Health Connector. She's been monitoring the chat and understanding that there is lots of discussion there, but she's picked up a very good and timely question to the panel. Adriana, do you want to present the question?
Yeah, so hi everyone, nice to see you all. I'm Communities Manager at the Global Health Connector, and we have one question from the audience, from Sean, who is asking, with a growing internal population and challenges in healthcare delivery capacity within the continent, can the different members of the panel see a time when Africa will be a net contributor to global healthcare? And if so, when? And indeed, how would this happen?
Yes. Can you see the time that Africa will be a net contributor to global healthcare? Dr. Francis, do you want to start on that? I think, yes.
Sorry, I was muted, sorry. Yeah, so there are different ways to approach that question. It's a very, very important question. Thank you very much for that question. But let me say that Africa is already contributing to global health in all ramifications. Because if you look at that same population thing I talked about, we're already achieving demographic dividend because the net production of young professionals now in healthcare globally resides between Africa and Asia. So we're already contributing to that. But then we are now talking about the digital space. And this is a conversation around economics. And one of the things that digital does is that if you do it right within your economic system, it further creates a multiplier effect on your economy and helps drive other industries in your economy. So I say by 2050, by then, Africa probably, I can give Nigeria as an example, probably have a population of probably about 240 million or thereabout. And if you look at that as a sample size for the continent, I think the youthful population, if we're harnessed, can be able to achieve a sort of digital demographic dividend for the continent, where we can say that a large chunk of the population is contributing economically through digital health to the country. Let's give ourselves the Agenda 2063, the African Union has an Agenda 2063, which is our Sustainable Development Agenda. But I think we can probably do before 2063, probably 2050, because we are already contributing to the professional workforce globally. It is just now to contribute that add-on in terms of how we leverage digital tech and promote it across the world.
Thank you so much. Ota.
Yes, thank you. Thank you very much, Dr. Francis, for laying that foundation. I think for me, I also just want to add that absolutely, and there are so many ways that Africa has been a net contributor. The shift has actually already begun. We're seeing that Africa is designing solutions under constraints, like from the get-go. We're designing solutions from under constraints, and the rest of the world, can learn from that. So we have climate shocks, we have young populations, which Dr. Francis just spoke about. We have supply chain vulnerabilities, and we have the need for resilient primary care. And we're designing from that, from the scratch, which the rest of the world can learn from. When countries build digital systems on solarized PHCs, for example, when communities co-design data use, and when interoperability is the default, that is the knowledge the world needs. So yes, just like Dr. Francis has said, I also do see a time when Africa is a net contributor to global health. In fact, I think the next wave of global best practice will come from here, from models that are reliable, models that are equitable, models that are climate resilient, and models that are built from the ground up. So our job is simply to document them well, fund the conveners who sustain them, and bring those lessons to the global spaces. Thank you. I just thought to contribute my thoughts.
Thank you so much. And to end this session, just very quick question to Vivian and to Francie. What can global partners learn from Africa's experience in building innovation ecosystems? So Vivian, you've been engaged with Africa Digital Health Network innovation ecosystem. Francie, you now work also for this innovation ecosystem between the continents. What do you think the global partners can learn from African experience? Do you want to start, Vivian? Short comment for the closing of the session. I think you are muted.
All right, thank you so much. Okay, so in terms of global experience, I think the global partners and the global ecosystem can actually learn from our resilience, and seeing how Africans have been able to we don't really need replication. A lot of times we need reinforcement. So too often I feel global frameworks actually arrive with pre-designed toolkits instead of beginning with a simple question like who is already doing what is working locally and how do we strengthen them. So I think what we can learn is how much innovation we're solving every day, and we can learn resilience from how young people are solving these innovations every day. We can learn contextual design and also community co-creation, right? A lot of time this is seen as the last step in innovation, but it's actually the foundation. Okay, so I think perhaps the biggest lesson is that Africa builds our innovation ecosystem from a people-centered approach and not from technology centered approach. And this is how solutions are able to thrive and survive, because they're embedded in relationships, in resilience, and in community, and not just softwares, right? So I think this is some of the lessons the global ecosystem can learn from Africa.
Thank you so much. Francie, one word for the end.
Yeah, thank you. I completely concur with what Vivian just said. And I want just to add another aspect is that the African innovators that I've met and that we will continue to see thrive, they turn challenges into opportunities, but with frugal and adaptive solutions. And it's absolutely incredible, and well, we are in awe in how they manage to meet local needs with these, I would say, constraints context. And I think global partners, they have a lot to learn from that. And I think that the world has to learn from that, because we are all under constraints now. And I think this is one of the incredible lessons we can get from these African innovators. Thank you.
Perfect. Thank you. Thank you so much. Thank you, Francie, Alta, Dr. Francis, Vivian, for joining me for this short conversation. This is just the start, and we at the Global Health Connector are committed to continue this exchange and discussion. Thank you. Goodbye.
Thank you, Caroline.
Thank you.
Thank you, everyone.
Thank you to everybody. Amazing.
Thank you.
Bye.
Pleasure.